Okay, guys, so today what we're going to talk about is Doctor's Guide for Nurses on how to report pain by the patient. So basically, when you are calling the physician, okay, when you're calling the physician, the patient's having a pain, there's few things that the physician is thinking about that I want you guys to also kind of know and have those answers ready when you are paging physician. All right, so I like to use this mnemonic here called Socrates. Okay, so when you're calling the physician, before you call the physician, few things you want to ask. First is the site. Where is the pain? Is it the abdomen? Is it the chest? Is it a headache? Where is the pain? Is it the legs? Is it the back? Okay, first figure out where's the pain. Okay, O is for onset. When did it start? Is it chronic pain or is it acute pain, right? So if this is something like chronic, just check if patient takes meds at home for it, okay? Like if it's neuropathy, right? So let's say if it's neuropathy, chronic neuropathy, are they on gabapentin? Are they on Lyrica? Whatever, maybe you need to resume that, okay? If it's acute, okay, so let's say if it's stomach, right? Your abdomen, if it's an abdomen. Okay, so the onset is acute, started, let's say, 1 hour ago. Okay, start an hour ago. So it's the abdomen, start about an hour ago, right? C is for character. Character, is it sharp? Is it dull? Is it achy? Okay, that's the character. Okay, R means radiate. Does it move anywhere? So let's say if it's a right upper quadrant pain, right? Usually we think of like cholecystitis for right upper quadrant. Next question is, does it radiate to the right lower quadrant? Does it go epigastric in the middle? Does it radiate? It could be yes or no. It doesn't radiate, whatever. A stands for associated symptoms, okay? So is the patient having nausea, vomit, diarrhea? Like what is the associated symptoms, okay? T is like time. Now, since the onset was like 1 hour ago, now has it gotten better? Worse? Like since the time has progressed, right? E is exacerbation. So what make it worse? So what's making it worse? So like maybe the pain started an hour ago after eating. Let's say they were eating something and now it's worse after eating. Or let's say the patient happened to like turn and sleeping on the right side. Now it hurts. Now it hurts, right? So you got to figure out what makes it worse and also at the same time, what makes it better. So let's say after a bowel movement, now it's better. Okay. And then S stands for like scale, like 1 to 10. How bad is the pain? So again, you're calling a physician. Okay, patient says, these are the questions you want to ask the patient. Okay, patient tells you, oh, I'm having stomach pain. Okay, so stomach pain. Okay. Now, then you ask the patient, oh, is this a pain that you've been having for a long time? Like, is it chronic or is it acute? Did you just start having this pain? Okay. And when did it start? So if it's acute, oh, it started about an hour ago. Okay, started an hour ago. Okay. What does it feel like? Is it sharp, dull, achy? Like, what does your pain feel like? Then you ask the patient, oh, does it move anywhere? You know, like, okay, so the pain's in the right upper quadrant. Did it move to the, do you feel the pain on the right lower quadrant? You know, it's a yes or no question. Or maybe they're like, you know what, it doesn't radiate, it just stays on the right upper quadrant. Okay. Then you ask associated symptoms. Do you feel any nauseous, any vomiting, any diarrhea, any like blood in stool, right? So you ask associated symptoms. Then the time of onset. Okay, since the time of onset, so you said it started an hour ago. Is it better? Is it worse? Okay. Then you ask the patient, oh, what makes it worse? Is it after that you ate that you felt that, you know, the pain started? Or is it maybe you turned to the right side? Or maybe, or does it get better? Like, oh, you had a bowel movement now. Do you feel like it's better? And then the scale, like how much pain you're having, 1 to 10 or 0 to 10, right? And then also you want to ask the patient, or you want to let the physician know, you know, pain's been happening and you gave, let's see, Tylenol, and like, let's say 45 minutes ago, and now it's still patient has pain. Okay. So these are a few things that, like, you know, before you call the physician, just make sure you have more information than just like, oh, patient has pain. Because what's going to happen is you call the physician, you're like, oh, patient has stomach pain. Okay. The patient wants, then the physician's going to ask you, okay, where's the pain? Then you go back in the room and then you come back and you have the physician on hold. Okay. So now you get the answer. Then the physician asks, okay, does it radiate anywhere? Then you go back into the patient's room and you ask, like, you don't want to, you want to use your critical thinking skills, you know, like you are a nurse. Like we depend on nurses, right? You guys are so important to the healthcare. So just to make your life easy, also to have a good rapport with the physician, just kind of have these things, you know, answered before you call the doctor. Okay. Now, thank you. If you guys have any other questions, you can email me. If there's any other topics that you want me to cover, I like to do quick videos because I have a short attention span, and I'm sure many other people do as well. So my videos are very quick, straight to the point, and short. Okay. All right. If you have any questions or comments or concerns, just leave it in the comments below. Any topics you want me to cover, just leave in the comments below. I like to make videos, about 1 to 2 videos every, you know, few weeks. And yeah, so let me know. Thank you so much for your time, guys. Bye.